Welcome back, everyone. Next up, we have Pressure BioSciences, Inc. It trades on the OTCQB under the symbol PBIO and is a leader in the development and sale of innovative, broadly enabling pressure-based solutions for the worldwide life sciences and other industries. Their products are based on the unique properties of both constant and alternating hydrostatic pressure. Please welcome its president and CEO, Richard Schumacher. Welcome, Richard.
Thanks, Anna. Great to be back.
Nice to have you back. All right, take it away.
I'll be happy to do that. And thanks to everybody for taking some time out of your busy day to get an update from Pressure BioSciences. We're a instrument and consumable company about 30 miles south of Boston. All of our instruments are based upon the use of very high pressure. Pressure is an amazing force of nature. Pressure can be used to do many, many things that we and I as a scientist normally would do with heat and cold and pH changes and chemicals, but we can do a lot of these things with just the addition of pressure, such an amazing force. But before we start, I want to remind everybody that they should do their homework and look into Pressure Bio and all of our filings if you're thinking about maybe investing in our company. We are publicly traded. We're on the OTCQB. We are always up to date on our filings. We know how important it is. I've run, this is my fourth company, my fourth publicly traded company. All have been on NASDAQ before. So we take great care to make sure that we're up to date on our filings. So at this point, we're on the OTCQB. Besides myself as the founder and the CEO, you can read about my incredible team. Dr. Ting, Dr. Lazarus, John Hollister, and the board led by Jeff Peterson. Please go to our website, pressurebiosciences.com, and read about the backgrounds of these tremendous people. I will say that I've started 4 publicly traded companies. All were on the NASDAQ Stock Exchange. The combined market cap of the 4 companies is over $1 billion. And I can say that without a doubt, it's been a struggle for us for a while. But we think we're over the hump. In fact, we know we're over the hump. It feels great to be able to taste the success that we have talked about a little bit in press releases that we see for ourselves in 2023. So this is not a story, in my opinion, that's going to unveil itself over the coming years, as many companies are. This is a story that's starting to unveil itself. And in fact, we had a press release we'll talk a little bit about earlier today. I said everything that we do depends upon pressure. We use levels of pressure that are pretty much unheard of in the laboratory. If you look at the slide that's on the screen now, if you think about a vise, it's about 500 pounds per square inch, or PSI. You go to the lowest or the deepest part of the Marianas Trench in the Pacific Rim. So it's 7 miles of ocean in the Pacific Rim at the Marianas Trench. It's about 16,500 PSI. We have an instrument of which we have about 300 plus of these now throughout the world that generates pressure in a pressure chamber. We call it the PCT barocycler. And this gets to about 45,000 PSI. And the new instrument that we're really excited about is an instrument that we've developed over the last 5 or 6 years with the help of different groups like the U.S. Department of Agriculture, which gave us and our partner, Ohio State, $1 million to help develop this. This goes up to 60,000 PSI, but it's all safe because, as Anna said early on, it's hydrostatic pressure. We're compressing water. Water doesn't compress very well. So when we compress water, it goes down 5 or 6%, gets us the pressures that we need of 30, 40, 50, 60,000 PSI. And if anything goes wrong, we don't have an explosion that's going to happen. We have just water that's compressed that will go out of a safety port in the back. The company's got 3 technologies. We're only going to talk about one today, ultra-shear technology. The other 2 have been driving the company for a number of years. Pressure cycling technology, or PCT, where we turn pressure on and off. I guess the easiest way to describe it is like squeezing a cell, squeezing a bacterium or a virus until it breaks. That's one simple way of looking at it. We have 15 issued patents. We have several hundred publications, many of them from outstanding scientists around the world on pressure cycling technology. Barrefold technology We have 8 issued patents, and this is a technology where pressure is used to fix problems that pharmaceutical companies run into when they're developing protein-based drugs. A lot of times the protein that they're making in the lab can be misfolded, so it's not exactly the right shape, or it can actually aggregate with other molecules, other protein molecules that we're making, and pressure can be used to disaggregate and fix misfolded proteins. We won't talk about that. Again, you can see about many of those things about BaroFold and PCT on our website. We're going to talk about our third technology, UltraShear technology. We started working in UltraShear about 6 years ago. We have 7 now issued patents, including 2 in the U.S. It's an amazing technology. We're very, very thrilled about every day when we generate data about the number of applications and the number of areas that UltraShear can get into. Basically, UltraShear uses a combination of very high pressure, and it combines it with ultra intense shearing. And when you shear something at very high pressure, you can do some amazing things. And one of the things that we do, basically simple to say, is we make oil go into water and stay in the water. So we're going to learn about what we're doing with UltraShear as we go through this talk over the next few minutes. We do have customers all over the world for PCT. We have some for BaroFold, and now we have some for UltraShear technology. Most of our customers know us because of our PCT systems. Again, about 225 customers, about 350 of those instruments that are already sold all over the world, that are pressure chambers that people are using to break apart cells to release the nucleic acid and the proteins that are in the cell. Wonderful list of customers, 200 publications, very proud of what we do. They're very excited. But just to give you that background, it's important to know that we are a well-known company throughout the world with some amazing leaders in the biotech, the biopharma, and now we're getting into the cosmeceuticals and the nutraceuticals and the food and beverage and agriculture areas. So let's talk about emulsions. An emulsion is where we have 2 or more things that don't go together. We put them together, like our vinaigrette salad dressing. It's an emulsion. We have multiple things in there that don't go together. The vinegar, the oil, the water just don't mix. So we sort of make them mix by shaking it up together or by homogenizing them to a certain point and try to get them mixed. Milk is an emulsion. It'll settle out in time. So we have thousands, tens of thousands of emulsions that we run into every day. Paint, when we go to paint, we have to stir it up, generally speaking, if it's an oil-based paint, because it's going to settle out. These are emulsions. But there's also emulsions in pharmaceuticals, in health and wellness products, vitamin supplements, things like that. Cosmetics and other personal care items, there's a number of emulsions that are used. A lot of anti-aging serums are emulsions, agrochemicals, food and beverage. So there's emulsions in our life, and emulsions are by nature not very stable, and they have other drawbacks. So if you can make an emulsion more stable, then it can sometimes be a much better product, especially if it's a pharmaceutical or vitamin. If that vitamin is in oil and you're mixing that with water, it's not going to mix very well. So if you can make that oil and water mix better, if you can make it a better emulsion, you'll have a better chance of getting that active ingredient. Maybe it's vitamin D3, maybe it's curcumin or astaxanthin out of the oil. So we'll talk about emulsions and how to make emulsions more stable and more what we call bioavailable, so that whatever is inside that oil will come out better and be absorbed better by the body, whether it's a human body, an animal, maybe one of our pets, maybe it's a plant. So the problem, as I mentioned, with emulsions, general emulsions, is that they've got poor water solubility. They don't mix very well. They're not very stable. And generally speaking, when you have an active ingredient inside oil and you mix it with water, it's not going to be absorbed very well unless you turn it into what we see at the bottom of the slide, a nano emulsion. So nano emulsions are widely accepted as a significant improvement over the what we call macro and micro emulsions that we have every day. You get a pharmaceutical and it says on the outside, shake well before using, because it's an emulsion. And because it's an emulsion, it's settling out. And if you don't shake it well before you use it, you're not getting a homogeneous supply into your body. You're getting just part of it and not all of it. So you got to shake well before using. If you make it into a nano emulsion, a true nano emulsion, you might never have to put that label on that pharmaceutical again, because it'll always stay in solution. It'll always be a homogeneous solution. If it's a nano emulsion, it's much more stable and much more homogeneous. So another sign of a true nano emulsion is that when you put oil in water and you break the oil down to where it is what we call nano size, so it's smaller than the size of a bacteria. It's what we call under 100 nanometers. A very small nano emulsion is under 100 nanometers. We have our method of ultra shear. We call it ultra shear nano emulsion, which means it's under 100 nanometers. And when it's under 100 nanometers, it basically becomes invisible. The oil goes essentially into the water and it becomes transparent, and you can see through it. That's a true nano emulsion. So current methods of making nanoemulsions are not very good. They don't make very good nanoemulsions. If it's over 100 nanometers but under 1,000 nanometers, you could legitimately call it a nano emulsion if the size of that oil is greater than 100 nanometers. But it's not going to have those great qualities that a under 100 nanometer nanoemulsion will have. Again, the oil itself is smaller than the size of a bacterium. So you take a glob of oil and you break it into millions or tens of millions of tiny droplets of oil that are smaller than a bacteria, and that oil that's floating, all of a sudden it disappears in the water or in the liquid that you're putting it in. So ultra shear is our method of our patented method of making nano emulsions. It's our ultra shear technology. Again, combining ultra high pressure with very, very ultra and intense shearing. And if we put these two together, we make 1 + 1 = 10. And we actually take oil that's in water, and as we bring it to high pressure, release it at high pressure through a patented valve, and it shears the oil into tens of millions of nano-sized oil droplets. We spread the active ingredient in the oil. Maybe it's vitamin D3, maybe it's curcumin, maybe it's prednisone, maybe it's retinol that's in the anti-aging serums. We spread the oil droplets, and we break them into nano-sized droplets, and we spread that active ingredient into hundreds of millions, tens of millions of tiny nano-sized droplets. And all of a sudden, that material becomes far more stable, far more bioavailable. Whatever is in there is now going to be absorbed by the body much, much more. You're taking vitamin D3, you're taking curcumin, and you're getting 10 or 15% at best before the body excretes the oil with all of that good stuff in it. By turning it into a nano emulsion, the body's able to absorb much, much more. So it's a very important thing on any oil-based active ingredient to try to turn it into a nano emulsion so that it becomes much more absorbable by the body. We have 7 issued patents. 2 of them in the U.S. One is on a way to isolate the oil containing the active ingredient from the water that we're using to bring the pressure up. And the other one is very important. It's our nano gap valve. It's a very different. Here it is, 2023, and we get a patent on a valve in 2022 because it's so different. It's so different than anything that's out there. It is a non-clogging valve. It'll never clog on you. It won't stop the machine while you're doing your processing because it has built in a way to not clog the valve as you're putting things through the valve. And so we have an issued patent in the U.S. We have an issued patent in other parts of the world, and we think we'll be getting our issued patents in certain countries in Europe this year. So the market potential is enormous. This is just a picture showing you some of the options. We can go into pharmaceuticals, vaccines, because we can make the pharmaceutical much more bioavailable. You can dose it better. It's much more stable. Cosmetics and skincare, agrochemicals, health and wellness products, advanced materials and nanotechnology, lubricants and coatings, paint, food and beverages. All of those emulsions can be made into nanoemulsions. And if you can, you're going to get all the benefits of having a nanoemulsion. We think that based upon the data we've generated with our instrument, our patented instrument and our patented technology, we think we've got the best in class ability to make nanoemulsions in the world right now. I'm going to go through some slides with some data. I'm really not going to talk about the data. I'm really just going to point out the important part. We're going to start with pharmaceuticals. This is prednisone. Maybe a lot of listeners that are on this call have taken prednisone. I know I did several years ago for a skin rash. And prednisone is a steroid that is in oil, and it's not absorbed by the body very well. And I know that the doc who gave it to me said, rub it in very well and then let it settle and then rub it in again. And I know why he's telling me, because it's not going to absorb very well. So you want to kind of overdose it. We took prednisone, and on the left side, which says oil droplet size, we started with a very large set of oil droplets containing prednisone, and using our instrument, as it goes through the instrument multiple times, let's say 6, 8, 10, 12, in this case, 16 times, you get to about 8 or 10, and now you get to a level of diminishing returns. You get to 8 or 10, and we've reduced the size of the oil droplet from way over 200 nanometers, thousands of nanometers, down to about 40 to 50 nanometers. So we've reduced the size of the oil. The prednisone in the oil doesn't get affected, doesn't get changed at all. It's just the oil that goes from a handful of droplets to millions of droplets. So the number of prednisone molecules go from millions in a drop to just a handful in the tiny nano droplets. And so this proves that the oil droplet size, as it goes down, the other thing is that the oil starts essentially going into the water, and it becomes clear. You know what happens when you put oil in water and you stir it really a lot? It just breaks the oil up into bubbles and it gets very opaque. But if you have a true nanoemulsion, it should get clear. The oil size droplets are so small, they effectively are smaller than the wavelength of light, and light goes through. So that's when you know you have a true nanoemulsion. The next slide is on cosmetics, on retinol. I hear it almost every day now, commercials on TV about retinol, anti-aging. It's a very important molecule in anti-aging serums and creams. And we've reduced the oil that contains retinol down to about 54 nanometers. 100 nanometers is generally the size of a bacterium. So we're going down to half the size of a bacterium. And as we do that, the clarity of the oil and water mixture becomes much, much clearer. So it gets to about 80% clear. So we've reduced the size of the oil. It's going to be far more stable in that cosmetic, and it's going to work a lot better. It's going to be far more potent because its bioavailability is going to go up quite a lot, because it's a nanoemulsion. Agrochemicals, we did the same thing with neem oil. We reduced the size of neem oil. It increased the clarity. And again, the benefits of stability and absorbability go up greatly in a nanoemulsion. This is astaxanthin. Astaxanthin, if you haven't heard about it, it's one of the most, if not the most, potent antioxidant on the face of the earth. It comes from krill. It's red in color, and you can see on the middle slide, you can see what it looks like when it's an emulsion, but not a nanoemulsion. It's just a thick red color. And when you look on the right side, you can see it's become clear. It's still red tinted, but you can see right through it because it's a nanoemulsion. So as we reduce the size of the oil that contains the astaxanthin, it becomes a nanoemulsion and has all the benefits of being a nanoemulsion. Curcumin has gotten very hot lately. A lot of people are taking it as a supplement. We've reduced the size of the oil, very large oil drops to tiny little droplets. In this case, it went down to 37 nanometers, and the clarity went up a great deal. So again, the key thing here is that you're paying money to get a pharmaceutical, to get a cosmeceutical, to get a vitamin, and most of it is getting excreted with the oil out of the system in 2 or 3 hours when you take it. In a regular emulsion, in a nanoemulsion, the amount of absorbability, the bioavailability should go up 2, 3, 4, 5 times what you would normally get in a regular emulsion. This is CBD. CBD is what we call our low-hanging fruit. It has a lot of people are taking CBD as a supplement. A lot of people believe that it does some magical things for itself, but in the body. But if you don't absorb it, it's not going to do anything. It doesn't matter how good the CBD is. You need to break the CBD. It's in an oil, comes out of the plant in an oil. You need to break that oil down to where each droplet is smaller than a bacterium, down to a nano level. And if you do, the clarity of the CBD oil goes up tremendously. I have a picture coming up. But most important, you're going to get 60, 70, 80% of that CBD out into the body, and not 5, 10, 15% is what happens now. And here's a picture. On the left side, you can see the conventional process. When you just stir and homogenize CBD oil with water, it just becomes opaque. It breaks the oil up, but it just becomes opaque. That's the same material on the right. You can see how clear. You can actually see the lettering behind it. It's the same material. We nano-emulsified it. We broke the oil. Every oil drop in that sample on the left has been broken into millions of oil droplets that are less than 100 nanometers. And look how clear it is. That oil on the right that contains CBD is going to be far more absorbable by the body. The bioavailability is going to be there. So if it can help somebody sleep, if it can help somebody reduce inflammation, whatever someone believes it's helping them, it has better chance when you get 5, 6 times more out than you do when it's a regular emulsion. Here's just a depiction of what happens as you see, as we run through our ultra shear technology, or UST. You can see on the left side, the pre-UST, you can see the oil floating on the top and the water underneath. And then as it goes through the system, you can see that the oil is broken down so much, so small, that it actually goes into the water, and therefore now it becomes clear. So this is a depiction of 6 runs, and on the chart on the right, you can see in the orange, the size of the oil went down to about 50 nanometers, but the clarity went up to about 80% clear. So very exciting stuff, and we've built this machine to be able to scale. So whether you're doing, millions of cans of a soda, or you're just doing a small amount to put into your coffee, we have machines. The technology can be scaled to almost any level. It depends on how big the room is that you need to put the pump, the motor, and the rest of the machine in. Here's just the picture. As I said, on the top, we purchased a number of water-soluble nano-emulsions, and without fail, every one we've bought so far, and it's been about a dozen, we put it into water, we mix it up, and it just turns into a regular emulsion. On the bottom is our nano-emulsion. We put it into the same water, we mix it up, and it basically disappears because the oil is so small, it effectively goes into solution. So these are the ones we've talked about. Pharmaceuticals, we've talked about nutraceuticals, we've talked about vitamins and supplements. We've been successful in nano-emulsifying all of these. And so we decided a few months ago that we're going to commercialize this technology, and we have, and we'll talk about a press release that we put out earlier today. So in essence, we've changed the strategy of the company. We're going from selling instruments that go into laboratories to break apart cells, to release DNA, protein. We're still doing that. We still do a few $1 million in sales in those areas, and in the BaroFold area to help companies get protein-based drugs to market, very important. But we've put about 90% of our effort into ultra shear technology right now. This is Dr. Adrienne Denese. We have a partnership with Dr. Denese. We announced this a few months ago. We're doing 2 things with Dr. Denese. One, she wants to make a new generation of she's known for her anti-aging serums. She's #1 seller of cosmetics and skincare on QVC, selling $500 million in the last 20 years. We've announced that we have an ongoing collaboration. We're developing a nano-emulsified retinol for her, and this is going to go into her anti-aging serums, and this is going to become what she calls a whole new generation of anti-aging skincare products. So very excited. We're also working with Dr. Denese in the area of hair regrowth, because the big issue she sees is that the minoxidil and the other molecules are too big to get through the skin. The oil that they're in is just too big. So we're nano-emulsifying the oils that contain things like minoxidil. She believes, she's an MD PhD, she believes strongly that it'll get through the scalp and get to the dormant hair follicle. So I want to end it by talking about some news. Today, we announced a $1.5 million contract with a fantastic company that's in multiple states in the Mid-Atlantic area, primarily in Maryland. We are working with Kevin and Ken, the co-founders there. They're going to be marketing our ultra sheer processed nano CBD. They'll be putting it in their vials and their label and selling it in multiple stores that they have throughout the Mid-Atlantic area. And they have a wonderful business of online business of selling CBD products around the country. On March 1st, we were able to get our largest investor to exchange $10 million of secured debt into equity. On February 1st, we received a $600,000 order from China for 16 of our instruments. This is not ultra shear. This is the pressure cycling I mentioned first. We do have customers throughout the world, and we have a distributor in China that prepaid for 16 instruments for this year. On January 27th, we announced that we're doing a deal with One World Pharma and Isaiah Thomas, the main owner and the CEO of One World Pharma, terrific group, to develop a nano-based CBD sports recovery drink. And we had some dramatic results that we published on January 23rd, a marketing study that we did by nano-emulsifying THC. We brought our instrument into a California lab with their license, and they nano-emulsified THC. We did a study with about 15 people, and what normally would take 45 to an hour for a tincture to have effect, a THC tincture, the recipients were actually talking about 3 to 5 minutes already starting to feel it. So wonderful things going on with us. At this point, I want to bring Anna back, and I appreciate everybody being here. And I think we have 5 or 10 minutes for questions.
Great job, Richard. Yes. So you gave us an overview of the news PBIO released today. Congrats. Are there more like it on the horizon?
Yes, there are. And we've said this publicly, and I'll say it again. We're working with probably a dozen groups right now in earnest. We have 3 or 4 that are really marching along quite well. We've, like everybody else, we ran into problems in getting a number of the important materials. So supply chain really adversely affected us. We didn't have vials. We didn't have some of the most amazing plant-based compounds that we need to make our nano emulsion. We've been getting this in now, so we're ready to start in earnest. And we accepted yesterday an order for that should amount to about $1.5 million. Again, we sell things in bulk, generally, sometimes in vials, but we're not selling it directly. We don't go to the consumer. We want to sell through distributors. And CBD Supply, MD or Maryland, is a fantastic group that is going to do a great job getting this material out. And I think everyone's going to do very well, especially the recipients who are finally going to get a nano CBD that if it can help them, it will help them.
Wonderful. And also talk to us a little bit more about the recent 10 million conversion of debt into equity released on March 1st. And are there more conversions on the horizon?
So Anna, we need to clean up our balance sheet. We desperately want to get back on the NASDAQ. We were on NASDAQ 10 years ago. Our stock fell below $1, so we got delisted. It's tough in the OTC. There's a limited number of clearing houses, et cetera. So we have it as a major goal this year. To do that, we have to clean up our balance sheet. So to take a third, 30% of our debt and convert it into equity was fantastic. And now we're talking about increasing it even more. So yes, I believe there'll be other conversions that we'll be announcing in the near future.
And can you tell us more about the January 19th news relating to the nano THC marketing study?
Yeah, this was very exciting. You know, THC is something that has an effect that people feel. I woke up one morning trying to figure out how can I prove that nano-sizing a molecule gets it into the system. I said, wait a minute, what about THC? We went to some friends in California. We brought in our small instrument. We taught them how to use it. They have the license, we don't. This is in California. And they 3 or 4 weeks later, they made a bunch of nano THC. They normally would sell their non-nano THC, and it works fine, except if you're having an anxiety attack or you want to use it to sleep and you have to wait 45 minutes to an hour. If you don't inhale it, you're going to have to wait 45 minutes to an hour to feel the effects. They brought people in that normally buy their product, and they were saying overwhelmingly 3 to 5 minutes they started to feel it. In 10 to 15 minutes they were getting to their peak. So here's a way, by doing the right nano emulsification of the THC oil, we're able to use a tincture and get the effects in minutes that normally take half an hour to an hour. Unbelievable.
So how widespread could this nano emulsion get? What other applications can it move to?
You know, I the other day, my son is a freshman at Northeastern University, and I was reading something about Northeastern, and they announced that they're working with a group that's developing a drug for pancreatic cancer, and they're using nano emulsions. And I said, why were they using nano emulsions? Because the drug in the oil, and then they nano emulsify the oil. The oil is now so small it can bring the drug into the pancreas and get through the maze of issues that are surrounding the pancreas when they have pancreatic cancer. So they can get it to the site. So nano emulsions were used in the COVID vaccines. So nano emulsions are everywhere. But to make them right and to make them so that you can stage them and make large amounts has been very difficult. We're just a bunch of engineers and scientists working with DNA, RNA, and we've been pulled into the CBD world because it's a huge problem. You can have the best CBD in the world, but if you're just excreting it out and only getting 10%, it's not doing anybody any good. And by showing that the THC can be absorbed in minutes rather than an hour, the THC molecule is very similar to CBD. So one can use it as a surrogate and say, okay, that means the CBD must be getting into the bloodstream in minutes and not hours. So far more available, far more stable. Very excited about that. And there's more coming. We're continuing that study and looking forward to a day when we can talk about another 15, 20, 50 people that have tried it in a marketing study.
Wonderful. Well, congratulations on all this progress, Richard. Thank you for joining us for this update.
Hey, thanks a lot, Anna. Appreciate it.
Okay, everyone, stay with us. We'll be right back with our next presenter.